Welcome to our NMC CBT mock test part 2 video for those preparing for CBT. In this video we have included 25 multiple choice questions with answers. Besides, each answer comes with an answer reference, and that will help you to answer any other questions related to the same topic. We recommend you to take an online test after completing the section and check your score. Options will be shuffled and given when you take an online test, and this challenge will really help you to thorough the answers. You can take test from the first link in the description. Question 1. You are working in a medical ward and one of your patients suddenly became very ill, got intubated, and had other life-saving procedures carried out. You are documenting all the events and at the end, you realized that all the documents are in another patient's chart. What would be your best response in this situation? Option A, you should continue documenting in the same file as the medical document cannot be corrected. Option B, you should put a straight cut over her documentation and write as wrong, sign it with her NMC code, date and time. Option C, you should tear the page from the file and start documenting in the correct record. Option D, you should write as wrong documentation in a bracket and continue. Option B is the right answer. You should put a straight cut over her documentation and write as wrong, sign it with her NMC code, date and time. As you know, if errors happened in the medical records, you should follow the proper error correction procedure. Question 2. Calculate the fluid volume balance for your patient whose intake is 2,437 milliliters and output is 750 milliliters. Option A, 1887, negative balance. Option B, 1887, positive balance. Option C, 1197, positive balance. Option D, 1197, negative balance. Answer is option B, 1887, positive balance. If the person is said to have positive fluid balance if his intake is greater than his output. As we know, if the intake is more than the output, the patient may have a fluid overload. Question 3. Choose the accurate signs of anaphylaxis. Option A, swelling of tongue and rashes. Option B, dyspnea, hypotension, and tachycardia. Option C, hypertension and hyperthermia. Option D, cold and clammy skin. Option A, option B, and option D are the correct answers. Swelling of tongue and rashes, dyspnea, hypotension, tachycardia, cold and clammy skin. Sign and symptoms of anaphylaxis include skin reactions, low blood pressure, constriction of your airways, and swollen tongue or throat, which can cause wheezing and trouble breathing, a weak and rapid pulse, nausea, vomiting, or diarrhea. Question 4. You are a nurse preceptor working with one of the new nurses and observes that the new nurse is reluctant to delegate responsibilities to her team members. In your view, what would be the reason for this reluctance observed? Option A, lack of trust in the team members. Option B, the orientation provided to the new nurse. Option C, role modeling behaviors of the preceptor. Option D, the philosophy of the new nurse's school of nursing. Answer is option A. Lack of trust in the team members. Well, it may be the team members are unwilling to do the assigned work. That is the reason she has lost her trust in the team members. Question 5. Monitoring of vital signs for patients and documentation is expected in long-term care facilities. These tasks can be delegated to which of the following category staff? Option A, registered nurse. Option B, practical nurse. Option C, nursing assistant. Option D, volunteer. The right answer is option C. Nursing assistant. According to the job description and skills of the nursing assistant, you can delegate the tasks. Question 6. You are helping your patients at meal time and are about to hand in a food tray with roast beef for dinner and whole milk as a beverage to a Jewish patient. What would be your best action in this situation? Option A, deliver the food tray to the client. Option B, replace the whole milk with fat-free milk. Option C, call the dietary department and ask for a new meal tray. Option D. Ask the dietary department to replace the roast beef with pork. The right answer is option C. Call the dietary department and ask for a new meal tray. First of all, you should know Jewish dietary regulations. They must not eat milk and meat together. So you have to report to the dietary department about the problem quickly and effectively and ask for a new meal tray. Question 7. You are an operating room nurse. While going through the chart of a patient who is medicated for surgery, you have observed that the consent form has not been signed. Which among the following would be the best action for you to take? Option A. Assume it is emergency surgery and the consent is implied. Option B. Tell the surgeon that the consent form is not signed. Option C. Have a family member sign the consent form. Option D. Get the consent form and have the client sign it. Answer is option B. Tell the surgeon that the consent form is not signed. Surgical consent is very important to take prior to the surgery. It gives permission to the surgeon to perform the surgery. Without this consent given for surgery is considered as a criminal offense. Question 8. What would be the indication to monitor orthostatic blood pressure? Option A. If the patient has a recent history of falls. Option B. If the patient has a history of dizziness or syncope on changing position. Option C. If the patient has a history of hypertension. Option D. If the patient has a history of hypotension. Answer is option B. If the patient has a history of dizziness or syncope on changing position. The test is considered positive if systolic blood pressure falls 20 mm Hg below baseline, or if diastolic blood pressure falls 10 mm Hg below the baseline. If the symptoms occur during testing, the patient should be returned to the supine position immediately. Question 9. You are communicating with a patient who speaks a different language. Which among the following would be your best action? Option A. Speak to the client and family together. Option B. Speak loudly and slowly. Option C. Stand close to the client and speak loudly. Option D. Arrange for an interpreter to translate. The right answer is option D. Arrange for an interpreter to translate. As we know, the translation is necessary for the spread of information, knowledge, and ideas. It is absolutely necessary for effective and empathetic communication between different cultures. So we should always have to arrange for an interpreter to avoid miscommunication. Question 10. You are looking after a patient who has a diagnosis of cancer, and after undergoing surgery the patient was told chemotherapy will be necessary. This patient is stating to you that, "I have read a lot about complementary therapies. Do you think I should try it?" What would be your best response? Option A. There are many different forms of complementary therapies. Let's talk about these therapies. Option B. You need to ask your physician about it. Option C. I would try anything that I could if I had cancer. Option D. It is a tendency to view one's own ways as best. The correct answer is option A. There are many different forms of complementary therapies. Let's talk about these therapies. In many cases of cancer, surgery offers the best chance of getting rid of the disease, especially if it hasn't spread to the other parts of the body. As we know, complementary therapies do not aim to cure cancer, instead they are used to help control symptoms such as pain and fatigue. Question 11. You are working in a medical surgical ward, and a registered nurse from Women's Health Clinic is temporarily redeployed to your ward. In your opinion, which among the following patients can be assigned to this RN? Option A. A client admitted for a barium swallow after a transient ischemic attack. Option B. A newly admitted client with a diagnosis of pancreatic cancer. Option C. A newly diagnosed client with type 2 diabetes mellitus, who is learning foot care. Option D. A client from a motor vehicle accident with an external fixation device on the leg. The correct answer is option D. A client from a motor vehicle accident with an external fixation device on the leg. As we know that the health clinic nurse can be assigned to give routine care to a client from a motor vehicle accident with an external fixation device on the leg. We recommend you to take an online test after completing this section and check your score. Questions and options will be shuffled and given when you take an online test, and this challenge will really help you to thorough the answers. You can take test from the first link in the description. Question 12. A registered nurse is exempted from legal action according to the NMC Standards Code and Conduct in which of the following circumstances? Option A, possessing stock medications. Option B, convicted for fraud. Option C, convicted for theft. Option D, fixed penalty for speeding. Option D is the right answer, fixed penalty for speeding. As a registered nurse, we know that this is an extremely challenging time for professionals. Our codes and standards continue to support you by providing key principles you should follow, alongside the ethical frameworks that normally guide your practice. Question 13. You are a nurse working in an emergency room. Emergency medical service team brought an unconscious patient post-road traffic accident with head injury and multiple fractures. This patient requires emergency craniotomy and needs to be shifted to theater immediately. The name of the client is not known. What would be the most appropriate action with regards to informed consent prior to surgical procedures? Option A, transport the victim to the operating room for surgery. Option B, obtain a court order for the surgical procedure. Option C, ask the emergency medical services team to sign informed consent. Option D, call the police to identify the client and locate the family. The correct answer is option A. Transport the victim to the operating room for surgery. Well, in case of an emergency situation, if the patient is unconscious and cannot provide his or her own consent, in this situation we have to provide immediate treatment in order to prevent death or serious health impairment. Question 14. Which among the following steps is not included in Tuckman's group formation theory? Option A, forming. Option B, norming. Option C, storming. Option D, accepting. The right answer is option D. Accepting. Accepting is not a valid choice. The Tuckman's Ladders team development stages are forming, storming, norming, performing, and adjourning. Question 15. Which of the following is the most appropriate response to describe the concept of acculturation? Option A, it is a subjective perspective of the person's heritage and sense of belonging to a group. Option B, it is a group that shares some of the characteristics of the larger population group of which it is a part. Option C, it is a process of learning a different culture to adapt to a new or change in environment. Option D, it is a group of individuals in a society that is culturally distinct and has a unique identity. Answer is option B. It is a group that shares some of the characteristics of the larger population group of which it is a part. As we know, acculturation is the transfer of values and customs from one group to another. The modification of the culture of a group or individual as a result of contact with a different culture. Question 16. You are looking after a patient in a critical condition who is capable of making decisions, refuses the transfusion of blood products. Choose the appropriate response from the given below in this situation. Option A, the doctor will decide. Option B, let the family decide. Option C, administer the blood product against the patient's decision. Option D, accept the client's decision and give information on the consequences of his actions. Option D is the correct answer. Accept the client's decision and give information on the consequences of his actions. Refusal of blood transfusion may be immediately life-threatening. It may cause a risk of long-term damage to the client. If it happens, written documents are needed and should be signed by the client for the legal issues. Question 17. As a registered nurse, how do you treat your patient with respect and dignity at work? Option A, behaving in a professional manner. Option B, communicate effectively with them. Option C, compassion, support and reassurance to the client. Option D, giving advice on healthcare issues. The correct answer is option C. Compassion, support, and reassurance to the client. The most important human needs are the desire for respect and dignity, so always treat them with compassion, support, and reassurance. We gently remind you to take an online test after completing this section and check your score. Questions and options will be shuffled and given when you take an online test, and this challenge will really help you to thorough the answers. You can take test from the first link in the description. Question 18. You are approached by a police officer at the nurse's station and is asking information about a particular patient. You know that you can give the necessary information if: Option A, there is a clear risk of safety and potential harm to the public. Option B, the hospital manager is authorized to give the information. Option C, the police show his identification. Option D, the police officer has the right to such information. Answer is option A. There is a clear risk of safety and potential harm to the public. As we know that nurses do not have to provide patient information to the police unless you have the consent, or the police have a warrant or other legal order requiring disclosure of the information. The nurse should know that she can give the necessary information if there is a clear risk of safety and potential harm to the public only. Question 19. Choose the most common aneurysm site from the given below. Option A, renal arch. Option B, circle of Wills. Option C, hepatic artery. Option D, abdominal aorta. The right answer is option D, abdominal aorta. Well, most aneurysms occur in the aorta, the main artery that runs from the heart through the chest and abdomen. Aneurysms also can happen in arteries in the brain, heart, and other parts of the body. Question 20. A nurse with medical surgical unit experience is asked to work in the orthopedic unit and has no orthopedic nursing experience. Which among the following patients can be assigned to the medical surgical nurse? Option A, a client who had an above-the-knee amputation yesterday and has a temperature of 101.4 F. Option B, a client who had a total hip replacement 2 days ago and needs blood glucose monitoring. Option C, a client with a cast for a fractured femur and who has numbness and discoloration of the toes. Option D, a client with balanced skeletal traction and who needs assistance with morning care. Option B is the correct answer. A client who had a total hip replacement 2 days ago and needs blood glucose monitoring. It is the responsibility of all the nurses to perform the blood glucose monitoring, and all the nurses should be familiar with the importance of blood glucose monitoring and the procedure. Question 21. Injection furosemide 24 mg infusion is ordered for 12 hours. How much dose is infused in an hour? Option A, 2 mg per hour. Option B, 4 mg per hour. Option C, 1 mg per hour. Option D, 3 mg per hour. Option A is the correct answer. 2 mg per hour. According to nursing calculations, an infusion of 24 mg injection furosemide is ordered for 12 hours, and for 1 hour it will be 2 mg, which is to divide 24 by 12. Question 22. Your patient who is on antihypertensive medication discussing his intention to take herbal substances to control the blood pressure with you. Choose your best action from the given below. Option A, encourage the client to discuss the use of an herbal substance with the healthcare provider. Option B, tell the client that herbal substances are not safe and should never be used. Option C, tell the client that if they take the herbal substance, they will need to have their BP checked frequently. Option D, teach the client how to take their BP so that it can be monitored closely. Option A is the right answer. Encourage the client to discuss the use of a herbal substance with the healthcare provider. Herbal medicine aims to return the body to a state of natural balance so that it can heal itself. Different herbs act on different systems of the body. To encourage the client to discuss the use of a herbal substance with the healthcare provider. Question 23. The code is the foundation of which among the following? Option A, good nursing and midwifery practice, and a key tool in safeguarding the health and well-being of the public. Option B, hospital administration. Option C, dress code. Option D, personal document. The correct answer is option A. Good nursing and midwifery practice, and a key tool in safeguarding the health and well-being of the public. The Code of Practice helps employers to understand what standards they should expect of health or social care support workers. A well-written code of conduct clarifies an organization's mission, values, and principles, linking them with standards of professional conduct. Question 24. Nurses' first allegiance is to which among the following according to the Nursing Code of Ethics? Option A, healthcare organization. Option B, physician. Option C, client and the client's family. Option D, client only. Option D is the right answer. Client only. According to the Nursing Code of Ethics, the nurse's first allegiance is to the patient. We encourage you to take an online test after completing this section and check your score. Questions and options will be shuffled and given when you take an online test, and this challenge will really help you to thorough the answers. You can take test from the first link in the description. Question 25. You have an order to infuse injection metronidazole 100 milliliters over half an hour. What would be the dose that can be infused over an hour? Option A, 200 ml. Option B, 300 ml. Option C, 50 ml. Option D, 150 ml. Option A is the right answer. 200 ml. According to the nursing calculation, 100 ml of injection metronidazole for half an hour, so for 1 hour, it will be double the amount, that is 200 ml. If you find our sample CBT questions and answer reference useful, please like our video. More CBT questions will be uploaded in the coming days. To get the notification, consider subscribing our channel. Visit our YouTube channel for more clear-cut medical subjects.